Hi, this is Unit 2 for the subject workshop practice. Here we introduce you to first aid. After the completion of this unit, you should be able to apply the correct first aid procedures in a simulated accident scenario in a workshop environment. Let's start with the definition. So first aid is an immediate and temporary care given to a victim of an accident or sudden illness before the services of a physician is obtained. Remember, an accident can happen now. So before the emergency services can arrive, you as a first aider, what action can you take to make sure this person is well taken care of while waiting for emergency services to arrive? So the purposes of a first aid is to save life, prevent further injury, and to preserve vitality and resistance to infection. Phases of first aid. It's self-aid, assistance from a companion, emergency treatment, and initial surgery. We don't just apply first aid. There's rules associated to this. So the first one is do not get excited. First, check for danger and check for responsiveness. Determine whether the victim is conscious. If the victim is conscious, ask him or her what happened and what is wrong now. Where are they feeling pain? If the victim is unconscious, proceed to check for the airway, breathing, and circulation. Commence resuscitation as appropriate. Do not move the victim unless it is necessary. If necessary, move a casualty, seek assistance if possible, and handle gently. Number 3, keep the victim lying down with his head or her head level with his feet or her feet while being examined. Number 4, keep the victim warm and comfortable. Remove enough clothing to get a clear idea to the extent of the injury. So you don't remove all the clothes, just enough to get a clear idea of where the injury is. Okay, number 5, examine the victim gently. Treat the most urgent injuries first and then treat the other injuries to the best of your abilities. So you'll start with the most severe injuries, then you move to the other ones. But bear in mind, to the best of your abilities. So you don't try and do anything that you are not trained for. We're only applying first aid. We're not doing surgeries. Number 6, avoid allowing the victim to see his own injury. Assure him or her that his condition is understood and that he will receive good care. Number 7, do not try and give any solid or liquid substances by mouth to an unconscious victim, nor to a victim who has sustained injury. Number 8, do not touch open wounds or burns with fingers or other objects except when sterile compresses or bandages are not available and it is absolutely necessary to stop the bleeding. Number 9, do not try to arouse an unconscious person. So let them stay in the sleeping position. Number 10, seek medical attention immediately. Hurry cases in first aid. Stoppage of breathing. So when a person stops breathing, critical time is 4 minutes to restore the victim to normal before brain damage takes place. So time is of an essence here. How do we manage this casualty? First, clear the airway. So anything that might be blocking this person from breathing, so you remove those obstacles first. Number 2, inflate the lungs with 5 quick breaths, then proceed to CPR. Severe bleeding. When a person is bleeding severely, bleeding and hemorrhage mean the same thing. Namely, the blood is escaping from the arteries, capillary vessels, or veins. The types of hemorrhage, the first one is arterial bleeding. When blood from an open artery, the color of the blood is bright red. The blood spats which are synchronized with the pulse. Number 2 on the types of hemorrhage is the venous bleeding. So this blood is coming from an open vein. The color of the blood is dark red. The blood escapes in a slow, steady flow. Number 3 is capillary hemorrhage. The blood is from damaged capillaries. The color of the blood is intermediate between bright red and dark red. The blood only oozes from the wound. This is the common type of hemorrhage. Controlling external bleeding. How do we control external bleeding? The first one is direct pressure. So A, digital pressure, where that's the pressure points. So it can be facial pressure points, carotid pressure points, or auxiliary pressure points. Femoral, temporal, subclavian, brachial. These fall under pressure points. Then B, compress and bandage, ligation tying, torsion twisting. So all these are all under direct pressure. The number 2 on the external ways to control external bleeding is elevate the injured part to lessen the flow of blood. Number 3, indirect pressure or tourniquet. Still on hard cases in first aid, poisoning. So if the poison was swallowed, the antidote is to dilute with water or milk to lessen the concentration of the poison. Milk coats the lining of the intestines. Then number 2, if the poison was inhaled, proper ventilation at once, open air. So you put the person in an open air environment. Number 3, if they contacted poison, you wash at once with soap and water, but soap is recommended in this case. Number 4, if the poison was injected as a snake bite, you expose the wound, you remove the clothing, you remove the shoes. Then lastly, you remove the casualty's jewelry. You safeguard or protect the jewelry, place it in the casualty's pocket. You don't keep it to yourself, but keep it in a safe environment. To determine the nature of the bite. So you look at where the bite happened. Is it from a non-poisonous or a poisonous snake? From a non-poisonous snake, it will have 4 to 6 rows of teeth. It will also have no flange marks on the victim. If it's from a poisonous snake, it will have 2 rows of teeth, 2 flange with which create puncture wounds. Signs and symptoms of snake bites. If it happened less than an hour ago, the person will have headache, vomiting, transcript faintness, confusion, or unconsciousness. B, if it happened between 1 to 3 hours, then you'll notice the dropping eyelids, double vision, difficulty in swallowing, enlarged lymph glands. Abdominal pain, dark urine, rapid pulse, and hemorrhage. If it happened 3 hours later, the symptoms will be paralysis in large muscles, respiratory paralysis, circulatory failure. Treatment. How do we treat snake bites? If it's from a non-poisonous snake, you cleanse or disinfect the wound. Use soap and water or an antiseptic solution. Use iodine if casualty is not allergic to it. Caution: if the bite cannot be positively identified as poisonous or non-poisonous, you treat it as a poisonous bite. B, if it's a poisonous bite, you rest the casualty or have the casualty lie down. Keep the casualty still or to delay the venom absorption. Apply a broad bandage. Keep beaten part below heart level. Immobilize the limb. Bring transport to the casualty. Don'ts: what not to do. Do not cut or incise the wound. Do not apply tourniquet. So tourniquet is a device for stopping the flow of blood through a vein or artery. So do not apply it. Do not wash the bitten area. Remember, this is a poisonous bite. So prevention or avoidance: know where the snakes are resting. They normally rest near logs, in heavy bushes or vegetation, in rocky edges or reefs. Okay, shock. Shock is a condition in which there is insufficient blood circulation to fill the blood vessels. As a result, the tissue do not receive enough oxygen to maintain the life, and there is extreme body weakness or physical collapse. The main causes of shock is hemorrhage, also loss of water due to nausea and vomiting, and loose bowel movement. Number 2, severe injuries such as burns and fractures. Number 3, asphyxiation or lack of oxygen. Other factors that may cause or aggravate shock: severe pain, wound infection, disease, exposure, fatigue, hunger and thirst, fear and worry, unnecessary or rough handling. What are the signs and symptoms of shock? The casualty is pale, skin is cold and clammy, pulse is rapid and weak, respiration is rapid, irregular and shallow. Number 5, if the casualty is conscious, he may be listless and drowsy and complain of thirst and dryness in the mouth. Number 6, the eye may have vacant, dull expression and pupils may be enlarged. Treatments for shock. How do we treat shock? Number 1, you control the bleeding. You give oral fluids, providing that there's no contradictions such as abdominal wounds or unconsciousness. Number 3, you keep the casualty comfortable and warm, but do not overheat. Number 4, lay the patient on his back with his feet higher than his head, except in cases of chest or head injuries. Then number D, fracture. So number D on the hard cases of first aid. Fracture is a break in the continuity of the bone. The kinds of fracture or types of fracture is open or closed. So open or compound fracture is a bone has broken through the skin. That's an open fracture. Closed or simple fracture is when the skin has not been penetrated on both ends. Signs and symptoms of fracture is deformity, present when injured limb lies in unnatural position or is angulated where there is no joint. Number 2, pain at the point of fracture. Number 3, crepitation or a grating sound. It is felt and heard when the bones rub together. Never move the injured extremely to determine crepitation. Number 4, discoloration. 5, loss of motion. 6, exposed bones. 7, swelling. And then 8, possible loss of pulse below the fracture. Okay, number E on the hard cases. Splinting is a device to immobilize an injured part of the body. What are the reasons for splinting? Firstly is to relieve the pain by minimized movement. Number 2, prevent further damage to the injury site. The general principles of splinting. Splint fracture where it lies. Do not reposition. If fracture is severely angulated, straighten it with a gently pull so that the limb can be incorporated into the splint. Number 2, immobilize fracture site before moving casualty. Splint should immobilize the joint above and below the fracture site. Number 3, pad splints before applying. Number 4, dress all wounds and or open fracture prior to splinting. Number 5, check for neurovascular function before, during, and after application of splint. Then number F on the hard cases in first aid is burns and scalds. Burn is an injury that results from heat, chemical agent, or radiation. It may vary in depth, size, and severity. Scald is a burn caused by liquid. The classification of burns. Number 1 is the depth. How severe is this burn? So they classify them as first degree, second degree, and third degree. So first degree is when the outer skin is reddened and welted or slightly swollen. Second degree is when the underskin is affected and blisters are formed. Then third degree is when the skin is destroyed and tissues underneath are damaged. Number 2, the causative agent. What caused the burn? A can be thermal agent or heat. Number B can be electricity. C can be radiation burns. Or D, which is the chemical agent, which can be acids or alkali. Treatments for first degree burns. Number 1, you immerse the burnt area in cold water until the patient ceases to feel pain. 2, when it is possible to immerse the burnt area, moist cold towels should be applied and renewed frequently. Number 3, follow this application for dry dressing. 4. If desired, a simple pen ointment may be applied. The treatments for second-degree burn, you follow the steps prescribed in the first-degree burns, except that we do not apply any burn ointment. 2. Gently blot area dry with sterile gauze or clean cloth. Number 3. We apply sterile gauze or clean as protective dressing. 4. Never break the blister. Treatments for third-degree burns. Do not remove adhered particles or charred clothing. Number 2, cover the burnt area with sterile dressing or freshly laundered sheet. 3, do not allow the victim to walk. Then lastly, if medical help is not available for 1 hour or more and the victim is conscious and not vomiting, give a weak solution of salt and soda. Then G on the hard cases of first aid is fainting. Fainting is a loss of consciousness caused by temporary reduction of blood supply in the brain. What are the causes of fainting? Firstly, it can be emotional. Number 2, it can be fatigue. Or lastly, hunger. The signs and symptoms of fainting: weakness, pallor, unconsciousness, dizziness, or cold sweat. What are the treatments for fainting? Firstly, you sit the person with their knees far apart and hold head far down between knees for about 5 minutes. 2. If the victim loses consciousness, lay him down on his back with a head turned to one side. So it can be on the left or right, but it must be on the side. Then number 3, after consciousness return, keep the victim quiet for about 15 minutes. Then number H on the hard cases of first aid is unconsciousness. Unconsciousness is when a person who does not respond to any spoken word or does not obey a shouted command. Observation to the unconscious. You check for the ABC. Check the airway, you check for breathing, and then you check for circulation. Number 2, check for hemorrhage. Is there any bleeding? Number 3, check for fractures. 4, check and record vital signs. And then lastly, check the size and reaction of the pupils to light. A. If the pupils are dilated, the possible causes can be shock, cardiac arrest, brain damage, substance abuse, disorder of the central nervous system. B. If it's constricted pupils, it can be a head injury, stroke, or substance abuse. Okay, you also check for the eyelid response, the response to speech, and the response to pain. Okay, this picture here shows us the different pressure points where we can apply pressure at the different types of wounds. So you look at the position of the wound and then you check where you can apply the pressure. Okay, so this figure here shows us how to apply a tourniquet from A to D. So A, you make a loop around the limb, tie with square knot. Then B, you pass the stick, scabbard, or bayonet under the loop. C, you tighten the tourniquet just enough to stop the arterial bleeding. Then D, you bind free end of the stick to limb to keep the tourniquet from unwinding. So when a person is lying down unconscious, you need to apply CPR, which is the cardiopulmonary resuscitation. So you first lay the person on their back and open their airway. If they are not breathing, then you start applying CPR. So you do the rescue breaths into their mouth to fill their chest. Then from there, you can start doing the chest compressions. This figure here shows you the correct positions of doing the chest compressions. So on A, it shows how do you put your hands on their chest. Then B, how do you upstroke and downstroke. So it must be between 1.5 seconds to 2 seconds. When you're checking for ABC, which is the airway, breathing, and circulation, if possible, use 2 rescuers. So one should do the lung inflation and then other one is doing the compressions. So 1 lung inflation after each 5 compressions, interpossessed between the compressions. So the ratio will be 5:1. So after each 5 compressions, you do the lung inflation. This is where we end it, but we'll have to make time for practical demonstrations. How do you apply first aid? So we have to do that one in the lab.